Is in-home care right for your loved one? Let's talk about it. Statistics show that 70% of people over 65 will need some type of long-term care in their lifetime. Making choices about home care services for aging parents can feel daunting, yet finding the right care remains crucial for their well-being. Most seniors feel comfortable when they receive care in their own homes. This comfort improves their emotional health naturally. My experience helping families direct their care decisions shows that home care services give vital support. These services range from daily activity assistance to medication management, physical and occupational therapy, and companionship. We're going to talk about the early warning signs that show the need for support, and if needed, creating a care plan. You'll learn about various care options and cost management strategies that help you make smart decisions about your parents' care needs. There are some big signs your loved one needs home care. Our parents' aging process brings its own set of challenges, especially when we start to notice small changes in how they live. Knowing these changes helps us give them the right support through home care services. Changes in daily routines. The first signs that your loved one needs help show up in their everyday activities. Seniors who have trouble with personal hygiene might bathe less often or wear the same clothes multiple days in a row. This often means they need support. On top of that, their eating habits might change. You might find empty cupboards, spoiled food in the fridge, or notice unexpected weight changes that point to problems with meal prep and nutrition. Money matters, and household tasks become harder to handle. Stacks of unopened mail, unpaid bills, or bounced checks might show up. More than that, a usually clean home that now looks cluttered or poorly maintained, especially in the kitchen or bathroom, suggests it's time to think about elderly home care services. Safety concerns at home falls are the biggest risk for seniors who live on their own. Each year, 1 in 4 older adults falls. These accidents send about 3 million people to emergency rooms annually. Seniors need help to stay independent safely by keeping walkways clear and bright, getting help with tasks that need good balance, taking medications correctly, keeping their living space tidy. Seniors who live alone face more risks of accidents, especially in bathrooms where floors get slippery. The kitchen also becomes a risky place when they forget about the stove or struggle to use cooking tools. Memory and cognitive changes can signal a need for help. Cognitive changes show up slowly, but need close attention. Seniors with mild cognitive impairment might struggle with language, judgment, and memory, though at first these changes don't seriously disrupt their daily life. You might notice they forget recent events, miss appointments, or can't keep up with conversations. They might also find it hard to make decisions or follow recipes they've known for years. These changes affect how they handle their medications. This matters a lot since about 25% of older adults take at least 5 different medications for chronic conditions. Their behavior might change too. Your parent might get irritated more easily, stop seeing friends, or seem confused doing familiar tasks. They might also get lost in places they know well, or lose track of their favorite TV show's plots. Only when we are willing to spot these signs early and get the right home care services can we help our parents stay independent while keeping them safe and healthy. Home care services are a great way to get tailored support that changes with their needs, letting our loved ones grow older comfortably in their own homes. You're going to need a basic understanding of home care services to help. The right choice in home care strengthens our parents' independence while they receive professional support. A clear understanding of available care services helps us create a tailored plan that meets their specific needs. Types of in-home care services. Home care services include both medical and non-medical support. Recent data shows 88% of adults aged 50 to 80 call it important to stay in their current homes as they age. Several care options support this wish. Personal care services. These services help with daily living activities, including bathing, dressing, and grooming. Professional caregivers help with personal hygiene while your parents' dignity and independence remain intact. Medical support. Home healthcare delivers specialized medical attention, including wound dressing and medication management, physical and occupational therapy, monitoring vital signs and health status, intravenous therapy, companionship care. Beyond physical help, companionship services provide emotional support through meaningful conversations, shared activities, and social interaction. These services help curb loneliness and maintain mental well-being. Household support. Home care helps with daily tasks like laundry, meal preparation, and housekeeping. Caregivers also assist with errands, shopping, and transportation to appointments. There are some real benefits of aging at home. Home care services for elderly parents bring many advantages. Seniors who receive care at home feel more peaceful in familiar surroundings. This familiarity reduces the stress and anxiety that often comes with moving. Home care provides personal attention that fits specific needs. The national median cost for home health aid services in 2024 was $37 per hour, letting families adjust care schedules based on their needs. Home care also lets families stay closely involved in their loved one's care experience, creating meaningful moments for parents and children alike. There's another reason why home care works well. It helps maintain community connections. Seniors who age at home keep their social networks, stay active in local activities, and maintain their independence. This social involvement proves vital for mental and emotional health. Home care services shine in their flexibility. Care plans adjust as needs change, from a few hours of weekly support to detailed 24-hour care. This adaptability will give your parent the right level of care without paying for services they don't need. Home health care shows impressive results, with seniors using these services seeing 50% fewer doctor visits yearly. It also guides patients toward better recovery outcomes, as they heal more comfortably in familiar settings. If they do need help, it's time to create a home care plan. A customized home care plan will give our parents consistent, quality care that fits their specific needs. Good assessment and organization can build a complete support system to boost their quality of life. Assessing care needs is going to be done by a professional. Quality home care services start with a full review of physical health, mental well-being, and daily living needs. We need to check any chronic illnesses, medications, and mobility issues that need attention. A complete assessment looks at several key areas: activities of daily living like bathing, dressing, and eating, medical support needs and medication management, social and emotional needs, mental health status and cognitive function, home safety considerations. Setting up daily schedules is going to be critical. Our parents' well-being depends on consistent routines. Regular schedules help improve immune function and protect circadian rhythm. Structured daily routines offer several benefits. Core activities, fixed times for essential tasks like medications and meals serve as anchor points. Other activities can fit around these based on energy levels and individual priorities. Time management. A stopwatch helps estimate how long caregiving activities take, which creates realistic schedules. This approach gives enough time for each task and prevents caregiver burnout. Building the care team. A strong and committed home healthcare team is vital for long-term success. The care team works together to provide complete support. Professional support. The team might include personal support workers for daily assistance, nurses for specialized medical care, physical therapists for mobility support, social workers for additional guidance. Team communication. Good communication keeps everyone informed about care responsibilities. Daily logs or notes help caregivers track and add observations, which maintains consistency across different care shifts. Regular reviews. The care plan needs review every 60 days or when needed. This ongoing assessment helps adapt services as needs change to maintain quality care. Team leaders must find creative solutions that encourage work-life balance for caregivers. About 97.3% of caregivers say they would work for companies that support this balance. Reasonable schedules and good support for care team members lead to sustainable, quality care delivery. Working with home care providers needs to be a priority. Quality care for our parents depends on choosing the right home care provider. A strong partnership that improves their well-being at home comes from careful evaluation and clear communication. Finding qualified caregivers can be a challenge. Understanding different levels of care professionals starts the search for competent caregivers. Home care providers usually offer several categories of caregivers. Companions. These professionals offer simple support with meal preparation, light housekeeping, and companionship. They become friendly faces who help maintain social connections. Personal care aides. PCAs do more than companionship duties. They help with more involved personal care tasks. Their training requirements vary from 0 to 100 hours based on state regulations. Home health aides. These specialists monitor vital signs and track physical and mental health conditions. Federal law requires at least 75 hours of training and 16 hours of hands-on practical experience. Here are the vital factors to think over before selecting a provider. Check the agency's licensing status and accreditation from organizations like the Accreditation Commission for Healthcare. Make sure caregivers go through full background checks and drug testing. Get details about the agency's supervision practices, particularly whether registered nurses oversee care delivery. Learn about the provider's emergency response protocols and backup staffing plans. Communication guidelines should be spelled out. Successful home care relationships are built on effective communication. Set up clear channels for regular updates about your parent's condition. Reputable agencies keep detailed care logs that document services, meals, and daily activities. To coordinate care effectively, set clear expectations. Talk about specific care needs, schedules, and priorities up front. The agency should develop a customized care plan that fits your parent's routine. Maintain regular contact. Review the care plan every 60 days to address changing needs. Ask for updates on your loved one's progress through specific communication channels. Address concerns. Promptly. Voice any issues that come up. Quality agencies welcome feedback and have clear protocols to handle complaints or caregiver changes. Note that all communication should stay respectful yet direct. Simple, clear language prevents misunderstandings. Open dialogue with the agency and caregiver ensures your parent gets consistent, high-quality care. Managing home care costs is always one of the first concerns people have. Money matters in home care give us the ability to make smart choices about our parents' care. Good planning and knowing what help is out there will keep quality care available and manageable. Insurance coverage options may be available. Home care costs can be covered by several insurance options. Long-term care insurance stands out as a key resource. These policies kick in when our parents need help with 2 or more daily living activities. As a result, the coverage helps pay for both medical and non-medical home care services. Medicare has some limits on what it covers. It won't pay for long-term home care, but Medicare covers skilled home health care in specific cases. To cite an instance, Medicare pays for physical therapy and skilled nursing care when doctors prescribe them. Medicaid works well as another option, especially when seniors have limited money. Home care services get coverage from most state Medicaid programs. Plus, some states let family members get paid as caregivers through consumer-directed care programs. Veterans and their surviving spouses might get extra support. The VA runs several programs that cover home care services. These benefits work alongside other insurance coverage to create a better care package. Payment planning strategies. Most families use private funds to cover home care costs. Even so, there are ways to handle these expenses better. Life insurance options. Some life insurance policies let you use living benefits for care needs. You can typically get 50 to 75% of the policy's face value for home care costs. Reverse mortgages. Homeowners who are 62 or older with good home equity can tap into reverse mortgages. This choice offers monthly payments or one big sum to pay for care. Family care funds. Siblings can work together through collective agreements to share care costs fairly. This way ensures everyone chips in while keeping care quality steady. Round-the-clock care with home health aides costs about $19,656 monthly. But many families find that part-time care works well enough, about $28.80 yearly for 20 hours each week. This flexible scheduling leads to affordable care plans while parents get the support they need. Programs in your area offer complete home care coverage to seniors with lower incomes. These programs run in 48 states now and can even combine Medicare and Medicaid benefits into one care service package. Learning about these payment choices and building a solid money plan helps ensure good home care for our parents without breaking the bank. We should check care needs and costs often to update plans when things change. This creates lasting care solutions that work,